Yeah, definitely. Before we get started, just kind of going over the speaking agenda so we're all kind of on the same page. I'll start off. I will actually introduce Hillary Aggert, who is the Woodford County Administrator, Amy Fox, who is the Tazewell County Administrator, then Dr. Greg Stoner, who is our Medical Director for Peoria City County Health Department, followed by Dr. Knapp, Dr. Samir Sater, and then we'll have distinguished guests here as well to answer any questions from various leadership as well. This one? Watch out for it, or turn it on? Good afternoon. I'm Monica Hendrickson. I am the administrator for the Peoria City County Health Department, and welcome to our Tri-County COVID press briefing. I'd like to welcome everyone and introduce Hillary Aggert, who is the administrator for the Woodford County Health Department.
Thank you, Monica. My name is Hillary Aggert with the Woodford County Health Department. As you probably are aware from the governor's press conference, that Woodford County does have a positive COVID-19 case. This individual was tested at a UnityPoint health clinic in Central Illinois. Positive results were received late Friday, March 13th. Public health officials were notified immediately according to the state and local public health protocols. The individual is currently recovering at home and is in isolation. Woodford County health officials are working closely with Peoria and Tazewell counties, as well as the Illinois Department of Public Health. We are investigating and notifying any individuals who may have had exposure to the individual who tested positive. The case and safety of our residents is our highest priority. All partners organizing this effort remain fully prepared to respond to the COVID-19 cases. Public health and hospital systems maintain highly trained infectious control teams, specialized equipment, and protocols consistent with the latest guidance from the Center of Disease Control and Prevention. The Peoria region is taking steps to increase its testing capacity and will share new information on testing as soon as it becomes available. As the governor has stated, we are asking all residents that may have symptoms to stay at home and to call a healthcare provider. Again, to call a healthcare provider. Please do not rush to the emergency room, as we would like our systems in the healthcare world to remain open for those who are critically ill. I would like to also talk about residents and encourage you all to learn different steps of taking precautions. Make sure that you're limiting your access to one another, as we would like you to know that we are looking at those close proximities. That's why you see a lot of our sector population canceling large events. We want you to stay home when you are sick, avoid touching your eyes, nose, and mouth, and avoid the close proximity to anyone who has potential symptoms of illness in general. We would like you to clean and disinfect frequently and follow CDC recommendations for using any proper PPE or face masks and shields. Thank you for your time.
As administrator for Peoria City County Health Department, I think it's important to note that this is a regional approach. It's not one single health department that is working on this, but the fact that our Tri-County, that over the years has built a strong collaborative partnership and is committed to the public health and our safety. With that, joint information and messaging will be done through our Central Illinois Public Information Officers. And I would like to also make a note that being that this is the first case that we've seen in our central region, This is why we are having this press conference. Moving forward, as cases increase, which we do have the expectation that they will, we will be releasing press briefings utilizing the governor's statements on his daily briefings. So with that, I'd like to also introduce now Amy Fox, who is Administrator for Tazewell County Health Department.
Thank you, Monica, and good afternoon. In accordance with Governor Pritzker's recent orders, we're no longer having large gatherings over 250 people. Another large gathering place, our places of worship, have been asking for guidance. Due to the increase of activity of coronavirus in the Tri-County, the local health departments are advising the use of teleservices or other social media where possible. Parishioners in the high-risk group, those 60-plus years of age, or with chronic health conditions should stay home as much as possible. Stay approximately 6 feet from others and avoid all ill people. And again, if you are ill with fever, cough, shortness of breath, contact healthcare providers and stay home. Worship leaders are a key partner in helping to reduce the spread of COVID-19 in our community. As the governor said in his press release or press conference at 2:30 today, every action we take saves lives. I'd like to introduce Dr. Greg Stoner, who's the Medical Director of Peoria City County Health Department and the Chief Medical Officer of Heartland Health Services.
Thank you, Amy. It's been stated about social isolation, and that's one of the keys to this. But keep in mind that this is something that we really did expect. When you look at the global changes, when you look at the national changes, we knew that this day was going to come someday, and so it is today. The advice that has been given all along about when to seek medical care, the advice as far as hand washing and social isolation has been the right advice all along. And the recommendations as far as school closing and canceling the IHSA tournament and all the things that have been done locally in this community were really kind of a little bit ahead of the curve and done in a very timely manner. So we are all working together, both hospital systems and the health department, and the health departments of both Woodford and Tazewell County to work on this problem. So again, social isolation is the key, keeping that 6-foot distance, and you're really working to not just take care of yourself, but really to take care of the whole community, and that is each of our responsibilities. So thank you. I'd like to introduce Dr. Keith Knepp, the Regional CEO and President of UnityPoint Health.
Thank you, Dr. Stoner. Thank you all for being here today. I'd like to start off by saying clearly to our community, we have all been preparing for this moment, as you heard. The fact that there's now a known case of COVID-19 in this region is not a surprise, given the global pandemic and the potential spread of this virus that we've known about for some time. With that said, it's imperative that we all work together and support each other to help minimize the spread of COVID-19 in the future, as you've already heard. UnityPoint Health, along with other health systems, has had long-standing plans for the management of infectious diseases in general and for crisis management in general, and we have enhanced those plans for this situation in recent weeks and months. We're also continuously monitoring and implementing the latest guidance that's provided by the WHO, the CDC, and our state and local health departments. We've been operating our incident command center both at a regional and system level and feel confident in our approach to continue to manage the situation. We're also grateful for the recent release of restrictions by the federal government, which will help us in testing and in providing care. For anyone in the community who's ill and needs to seek medical care, we ask that you please call ahead to your primary care provider or other point of care to let them know ahead of time that you have signs and symptoms. We do have testing supplies. We don't have unlimited testing supplies and capacity, so we continue to apply an approach to determine how to best use those testing resources And the best way for us to do that is for you to call ahead and make those plans and then follow the guidance that's provided. As of today, we are restricting visitors to our UnityPoint hospitals and inpatient facilities to help the people that we're caring for, especially those that are most vulnerable. I'll take a moment to outline what those additional visitor restrictions are. We're not admitting any visitors unless they're determined to be critically essential to the patient's well-being. We know there are needed exceptions for that. Some of those exceptions would be end-of-life care, childbirth, and those situations when a patient's visitors are considered to be essential for the patient's well-being and care. And visitors allowed within our facilities must be healthy. We strongly recommend you don't visit if you're displaying signs or symptoms of an influenza-like illness, which includes a fever, cough, or sore throat. And if you show symptoms, you may be asked to leave. We do understand these restrictions may impose an inconvenience to some families, and we apologize for that, but it's an important step to keep everyone as safe and healthy as possible. So we ask for your support as we implement those. What we need now is the help of the community to ensure our healthcare resources will allow us to continue providing the best care possible. So I'm going to turn over the microphone to the UnityPoint Health Chief Medical Officer, Dr. Samer Sater, and he's going to go through some of those items for you. Thank you.
Good afternoon. All the things that the health department and our leaders and elected leaders are doing right now are to reduce the number of cases that we get over a short period of time. The way that that occurs is by helping yourself, helping your family. That means social isolation. If you're ill, don't come out. If you are having a fever, chills, call your provider. Don't rush to the hospital. Don't rush to the emergency department. We are lucky in this community to have two great healthcare systems. We're lucky to have a great university, but those resources are limited. So we need you to take care of yourself at home, protect your family, and by doing those things, washing your hand, reducing the number of infections, don't spread any type of infection that you currently have, be it influenza or the COVID. That will help us save our resources for the people that need it the most. Monica?
Before we go into some questions from our press here, I do want to thank individuals from UnityPoint leadership that have made themselves available, as well as Peoria City Mayor Artist, Peoria County Chairman Andrew Rand, Tazewell County Board Chairman David Zimmerman, and then Representative Ryan Spain, who's actually going to speak directly about the impact Woodford County has.
Well, good afternoon, and let me also recognize Councilman Sid Ruckriegel is here in the office of Congressman Darren LaHood. All of your local elected officials are mobilized and engaged as we respond to this urgent health situation. I think one of the things that as elected officials we're most grateful for is the strong healthcare delivery system that we have here in Central Illinois, and our outstanding leadership of our local county health department administrators. So Monica Hendrickson from Peoria, Amy Fox in Tazewell, and Hillary Eggert in Woodford County. Our hat is off to all of you. Thank you for your round-the-clock work and efforts, and we're here to support you and do anything that we can to make the resources and leadership of all of our communities available so that we can work together through this situation. I think that we would again urge all of our constituents, all of our residents to be calm. The Peoria area has one of the highest concentration of healthcare workers on a per capita basis anywhere in this country. Our region is well positioned to deliver and work through this period of difficulty, but it will require sacrifices from all of us as citizens. And so we're asking people to stay at home, to work from home if you can, to be smart and sensible, wash your hands, limit your distance and interaction with others. And again, if you are sick, we ask you to call your healthcare provider, call your doctor. We want to make sure that the engines of our hospitals are continuing to work on a finely tuned basis. And so recognize that we have the appropriate infrastructure to advise you if you are feeling ill or symptomatic, and that our hospital systems have engaged the right structure to provide the care and comfort for you. And it may require that you are spending some time at home, but this is a sacrifice that we will all be able to work through together. In addition, though, I know that we have a very generous community, and as we grapple with our new reality of businesses that are closed, and particularly school closures now that will begin next week, we understand that this will create challenges throughout our region. And so we have a very generous community. If you are an individual or an organization that is looking to help us through this period of transition, we're very grateful to receive your help. We will be utilizing our regional 211 system to accumulate information and provide collect offers for assistance for donations of both food, money, supplies that may be needed. And in addition, my legislative office will help coordinate any of those entities that need assistance. So if you're a local school district that is looking for assistance in delivering meals, or you're a community organization providing services to the elderly, please contact my legislative office, either by phone, which is 309-690-7373, or by email. My email is repryanspain@gmail.com. And we'll use our office as, at least for now, the clearinghouse for some of those information for how we can really harness the generosity of our community during this time. Monica, thank you for your leadership, and to all the elected officials here working through this important and urgent healthcare challenge.
I know our UnityPoint partners were able to discuss what they have been doing, but we do have representation from OSF, St. Francis Medical Center, to speak what OSF is doing in our community as well.
Thank you, and good afternoon. My name is Michelle Conger, and I'm the Chief Strategy Officer for OSF Healthcare. I'm also the CEO for OSF's Digital Health Center. I guess, first of all, I'd like to thank everyone and all of the efforts, the healthcare workers, our legislators who've really come together to address this situation. Really an example of really what's happening here today, tireless commitment, and really a community that's come together. To better serve our patients and community, OSF Healthcare has launched a digital solution. It's a chatbot that's called Claire. You can access this chatbot via our website, osfhealthcare.org. You can do that on your computer. You can also do it on your phone. The purpose of this is to help patients in two ways. One, to get access to information, and secondly, to help triage them. A lot of the conversation that's been earlier is about the importance of patients being able to understand where and how to navigate the health system and not to go directly to emergency departments. If patients reach out and complete the questions via use of Claire, she will help navigate the patients to the appropriate locations or the appropriate phone number so they can get information. We know it's a challenge for people in terms of understanding how to navigate complex health systems, so we think this is going to be a great solution moving forward for all of the communities that we're serving. And now I would like to turn it over to OSF's Chief Operating Officer and Regional CEO.
Thanks, Michelle. My name is Mike Cruz. Michelle stated, I think it's a great opportunity to at least demonstrate some of the detail work that Keith Knepp described earlier. You know, there's 52 counties that OSF Healthcare spans, and as a result of that, we have a lot of responsibilities to those communities to work very closely with the departments of public health and other institutions and medical centers and universities that we work in those communities with. As a result of that, Emergency Operations Command Center has been open for 2 weeks now. We meet on a daily basis. We have daily briefings. And each of the different operating units or the hospitals or medical centers have their independent emergent command centers that are open And as a result of the pandemic response from the CDC, we have requirements to dictate what those surge capabilities are and how we activate those in times of emergency. So there's triggers that are built in that when they hit those triggers of being full or reaching certain severity of illness of patients that were being seen, we actually go into those surge capabilities. So from IT infrastructure to ventilators to staffing to housekeeping to transport to the ORs to elective versus not elective procedures are all thrown into those surge capacity plans that are required to have on file. So we've had to activate those in prior endemic responses. Although this might be new for COVID-19, as you well recall, we've had multiple of these viral incidents and bacterial incidents in the past 20 years alone. So with that, more locally, we have the opportunity to respond, and I think we have to recognize the fact that when we have a large influx of patients, especially those that are sick, we will tax the system. And as a result of that, we will have restrictions. Keith had mentioned several. We're going to work closely with the community. It'd be ideal to have very similar restrictions so that the community understands they are the same. And those will be enforced, and they are very restrictive by design. So only those patients who really require to have a family member, so typically it'll be down to one visitor per patient, and they may actually be screened as well, and that might be required before they can enter the facility. And we might enter into an era where we're actually screening our own mission partners or employees before they're allowed to take care of patients. That's very restrictive. In addition, if you're non-patient facing or patient caring or non-employed, so think of students. So whether you're a pharmacy student, nurse, medical student, and on, you might not be allowed to be on campus if we should reach those areas of restriction. And that's critically important because a lot of those students are in class, and as a result of doing this clinical work, it impacts their ability to graduate, take tests, or finish their semester. So we take that seriously in making those decisions. But if we should come to that, we'll make that clear in announcing how that could be impacting the community. And once again, we'd work closely with UnityPoint to recognize that, and also the College of Medicine, notifying Bradley and ICC if need be. We will take those drastic efforts should that come to pass. In the meantime, we will continue to work closely with the Department of Public Health, and when patients become positive or are persons under investigation, we'll have to respect the fact that we have to follow protocol in being transparent, and we have to respect the fact that those patients have to be notified by the Department of Public Health before we release that information, and we would not release any information that would violate the integrity of the system and the healthcare protection of their information of those individuals we're taking care of. And appreciate everyone for the help. It is a trying time, and we have a lot of resources. We have to use them to the best of our capability. And I think you've heard those details, that we continue to work closely with other universities and local communities. Thank you.
So as Representative Spain mentioned, not only is our community served by 3 local health departments, a federally qualified health center of Heartland Health Centers, as well as UnityPoint Health, OSF St. Francis Medical Center, but also we have a College of Medicine here. And with that, I'd like to introduce the interim dean for the region of UICOM, Dr. Ayer.
So as you have heard before, the University of Illinois College of Medicine in Peoria really values our collaboration and our commitment that we've been having with both the 2 large hospital systems to really provide care to our community at the time of this need of COVID-19. We've already put in place a lot of things, as you have probably heard from the university. We've adopted the principles of social distancing, and a lot of our students, starting Monday, have actually transitioned to online learning. And Dr. Cruz did talk about students in a clinical setting, and we've been working with both our hospital systems to ensure that the priority is really given to the health of the community in really changing the trajectory that we have of the transmission curve so that we have reduced number of COVID in the community and we can actually provide the care we need to the critically ill patient. And again, I would like to highlight and call out to the people that when you have symptoms of illness, whether it is fever or cough or cold, as much as it is mild, please make sure that you call your healthcare provider and let them know and follow the instructions that you get. And this is something we have been encouraging even our students to do and all members of the healthcare community to do as well. So I know these are really difficult and challenging times, but I think in the greater Peoria area, we are really lucky to have such strong health systems, a university, and a strong community, which can really come together to take care of our patients.
So with that, we will open it up for questions. Andy.
This man who tested positive, could you please tell us when he first came to the clinic? And could you also maybe tell us where this clinic was?
Information specifically regarding the testing of the individual and the case of that can be directed to the Illinois Department of Public Health and their public information and department.
Can you tell if this man had traveled outside the country recently?
We're currently investigating and working through his contacts. And with that, we don't eliminate anything such as travel history, whether it's abroad or local, or domestic, as well as relationship to other known contacts. So right now we're still in investigation mode, but we're not ruling out any of those type of aspects.
Can you go into any more detail about, is this person elderly, things of that nature?
I can turn that over to Hillary Aggert.
The individual that lives in Woodford County that we are communicating with and investigating additional contacts, as Monica said, all we can say at this time is this person is in their 70s.
And then, for example, we've already heard from some viewers that the Willow Hill United Methodist Church in Germantown Hills has been shut down because of a confirmed case in their congregation. Can you talk about what the communication is like with people that may have come into contact with this individual?
We are in contact with our community partners, and as Amy Fox had stated, that there are situations within churches that they're evaluating, that we know that this individual lives within our community. There are definitely different situations going on, and that's why the investigation process is in play, but I can't speak any further to that until it's completed.
Are any of you aware of any other confirmed local cases?
We are not at this time.
As far as there's a lot of things that you and every single person here has said the same thing over and over again because you're trying to hammer the point home. I get that, but what she just said, that people on social media are spreading stuff, they're passing stuff. What would you say? Here is your chance. You are live streaming to talk to these people. People are claiming to know them. They're claiming that they touched them. They're claiming that they went to that church. On and on and on. I get why you can't say some of this stuff, but is there anything that you could say to us and to them to try to calm some of the fear?
We do understand that individuals in our community are at the point that they want to know if they had potential exposure, and like I mentioned before, we are trying to do our contact tracing to understand who might be at medium or high risk for this individual. In the general population at large, we would say that it is low risk, but we are still evaluating that in our investigation process.
Should anybody who has come in contact with this person self-isolate on their own?
Well, that's where we're still doing the investigation, so I can't speak directly to that, but that's why the community at large, we keep promoting to limit your access within the school systems, the churches, or place of worship, as well as any other large gathering scenarios to try to eliminate that risk.
But what about the folks who might have seen him last week? I mean, the point is there are folks out there who reached out, who were in touch with him prior to this announcement. What should they do?
And that's where our departments of public health are actually doing that contact tracing. So if an individual was identified as potentially having exposure, we're reaching out to them and following up individually as well with their healthcare providers.
So would I take that, ma'am, to mean that if I don't hear from you within two or three days, I am fine from this thing, or what?
Again, we're unaware at the moment, with the spread continuing across the state daily. We're continuing to do our efforts at the local level to do as much investigation as possible, work with our healthcare provider systems to identify those risks and reach out to those individuals.
This is a polling place. This is a polling place for the election. Are you guys going to move it?
In terms of the church that you're referring to in Germantown, that would be working with the Election Commission to discuss that. I did want to touch base about the social media and those information. Tomorrow there'll be at 5 o'clock a simulcast out of WTVP's offices where we'll be offering up subject matter experts around the panel discussion to answer questions from the public in regards to COVID-19. I think a key thing to remember, and I think the administrator from Woodford County, Hillary Agger, really focused on, was the fact that because we now know, and I think all of us understand that the cases are in our community, being self-aware and taking on that stance of social distancing and isolating, especially when we're symptomatic, is very important to, again, control the number of cases. We want to decrease having too many cases in a short amount of time. Again, flattening the curve, as the term is.
The Illinois Department of Public Health in their release this afternoon said a Woodford County resident in his 70s. Can you confirm that it is a male?
Yes, we can confirm that.
So yesterday we heard in Peoria County there had been 3 people tested, 2 tested negative, 1 test was pending. Was this man the pending test?
No.
So can we say how many tests are currently out pending in Peoria, Tazewell, and Woodford counties at this time?
We don't have that information at the time of this conference.
Is that 1 test still pending then, the one in Peoria County?
It is.
You mentioned that the test results are usually pretty quick, a day, so now it's been 2 days. Is there a reason why it's still pending?
It depends on the type of testing facility that's being utilized, whether it's a state lab or one of our private labs. And again, commercial labs are coming up more and more every day, and as this continues, we do want to reiterate that when it comes to testing, it is still prioritized, and you should really speak and call a healthcare provider prior to starting or looking for testing. I think Dr. Knepp made it very clear in understanding that we understand there's going to be a lot of concerns in our community, but really speaking to your healthcare provider is going to be the best resource you have. Okay, well, thank you so much.